What is the term for a device used to take the place of a missing body part? A. Pronation. B. Abduction. C. External rotation. D. Prosthesis. The correct answer is D. Prosthesis. Number 2. When a client has left-sided weakness, what part of a sweater is put on first? A. Both sleeves. B. Left sleeve. C. Client's choice. D. Right sleeve. The correct answer is B. Left sleeve. Always dress the weak arm first. Number 3. It is appropriate for a nurse aide to share the information regarding a client's status with A. Anyone the nurse aide sees fit. B. The client's family members. C. The client's roommate. D. The staff on the next shift. The correct answer is D. The staff on the next shift. Number 4. When helping a client who is recovering from a stroke to walk, the nurse aide should assist A. On the client's strong side. B. On the client's weak side. C. From behind the client. D. With a wheelchair. The correct answer is B. On the client's weak side. Number 5. The nurse aide is caring for a client who is agitated. The nurse aide should A. Speak loudly so the client can hear the instructions. B. Ask to reassign the care of this client. C. Talk in a slow, calm, reassuring manner. D. Tell the client to be quiet. The correct answer is C. Talk in a slow, calm, reassuring manner. Number 6. The purpose for padding side rails on the client's bed is to A. Use them as a restraint. B. Have a place to connect the call signal. C. Protect the client from injury. D. Keep the client warm. The correct answer is C. Protect the client from injury. Number 7. Exercises that move each muscle and joint are called A. Adduction. B. Range of motion. C. Abduction. D. Rotation. The correct answer is B. Range of motion. Number 8. How can the nurse aide best help a client who is not accepting a loss? A. Leave the client alone. B. Convince the client to accept the loss. C. Encourage the client to talk. D. Discourage individual activity. The correct answer is C. Encourage the client to talk. Number 9. The Heimlich maneuver, or abdominal thrust, is used for a client who has A. A bloody nose. B. A blocked airway. C. Fallen out of bed. D. Impaired eyesight. The correct answer is B. A blocked airway. Number 10. To best communicate with a client who is totally deaf, the nurse aide should A. Smile frequently and speak loudly. B. Smile often and talk rapidly. C. Avoid eye contact. D. Write out information. The correct answer is D. Write out information. Number 11. The nurse aide is asked by a confused client what day it is. The nurse aide should A. Explain that memory loss is natural and the date is not important. B. Ignore the request. C. Point to the date on a calendar and say the date. D. Provide the date and then test the client later. The correct answer is C. Point to the date on a calendar and say the date. Number 12. To avoid pulling the catheter when turning a male client, the catheter tube must be taped to the client's A. Bedsheet. B. Upper thigh. C. Bed frame. D. Hip. The correct answer is B. Upper thigh. Number 13. A nurse aide can assist clients with their spiritual needs by A. Taking clients to the nurse aide's church. B. Allowing clients to talk about their beliefs. C. Avoiding any religious discussions. D. Talking about the nurse aide's own spiritual beliefs. The correct answer is B. Allowing clients to talk about their beliefs. Number 14. A nurse aide must wear gloves when A. Feeding a client. B. Doing pericare. C. Giving a back rub. D. Doing range of motion. The correct answer is B. Doing pericare. Number 15. When getting ready to dress a client, the nurse aide should A. Get the first clothes the nurse aide can reach in the closet. B. Give the client a choice of what to wear. C. Use the clothes the client wore the day before. D. Choose clothes that the nurse aide personally likes. The correct answer is B. Give the client a choice of what to wear. Number 16. If the nurse aide discovers fire in a client's room, the first thing do is A. Call the nurse in charge. B. Try to put out the fire. C. Open a window. D. Remove the client. The correct answer is D. Remove the client. Number 17. In order to communicate clearly with a client who has hearing loss, the nurse aide should A. Speak in a high-pitched tone of voice. B. Stand behind the client when speaking. C. Speak in a loud and slow manner. D. Look directly at the client when speaking. The correct answer is D. Look directly at the client when speaking. Number 18. Which of the following stages of dying is usually the final stage? A. Anger. B. Acceptance. C. Bargaining. D. Depression. The correct answer is B. Acceptance. Number 19. If a client says, "God is punishing me," or "Why me?" how should the nurse aide respond? A. Reply, "God doesn't punish people." B. Listen quietly. C. Ignore the client. D. Make jokes. The correct answer is B. Listen quietly. Number 20. The role of the ombudsman is to A. Run a group of nursing homes. B. Work with the nursing home to protect clients' rights. C. Control the nursing home budget. D. Prepare classes that nurse aides take to learn about client hygiene. The correct answer is B. Work with the nursing home to protect clients' rights.